husband, Richard needed a coronary bypass operation because it was estimated that he had about 90% obstruction. Things didn't turn out quite as well as we anticipated. He had complications right away. The hospital where Richard was staying was not part of the resurrection system. They could not provide long-term acute care, and that's what he needed in order to recover. They recommended Holy Family. Years ago, I had done some volunteering in Evanston at St. Francis Hospital, which is part of the resurrection system. So I was familiar with the name Resurrection. I had confidence in the name. Richard was in the back of the ambulance. I could hear the sound of that ventilator. Whoosh, whoosh, whoosh. You know, I knew that he was totally dependent on this ventilator for breathing. I kept thinking, what if something goes wrong with the ventilator?
He had really taken a turn for the worse. With all of Richard's medical problems, he had a very high risk of passing away. He developed acute kidney failure.
Well, it was scary, and I felt like I was in some sort of a bad dream situation. And it was just like, whoa, what's happening here? It's not a real comfortable feeling to see somebody with all kinds of tubes in them and needles. On the other hand, it gave me a very secure feeling to know that these people could see right in at everything that was going on, whether I was there or not, and they were monitoring him.
Hi, it's Chrissy with the EICU. So I'm going to be coming in and just looking at the ventilator and her IV fluids, okay?
The EICU is a form of monitoring that adds to the excellence of our medical center and provides a way for patients to be seen by physicians and medical staff without necessarily being in the same room.
I'm talking to you from the camera up on the ceiling.
It is an eyes and ears, if you will, on the patient constantly.
It's an integrative approach. We are a part of the ICU team. Our health system is one of 3 EICU centers in the Chicagoland area, located at Holy Family Medical Center. We're able to monitor a large number of patients. We have 193 critical care beds across 8 different facilities. The EICU staff are skilled practitioners, so they're astute into looking at acute findings that alert the clinicians to changes and subtleties in the patient's blood pressure and heart rate and respiratory status.
Hi, Kiana, it's Yvonne from EICU. Could you just tell the nurse for bed 1 the pressure's up 191? Thanks.
We're able to actually go into a patient's room via camera and video assess the patient and speak to the patient and the family.
I'm just going to look at your oxygen and your IV fluids, okay? I'll only be a few minutes.
There's nothing more valuable than saving a life. When they hear our caregivers, they're reassured that somebody is watching them, as if there's an angel from above that's caring for them.
I was very impressed with the staff at Holy Family. No one could guarantee an outcome for me, but they always had a plan.
I called Judy and I let her know how serious Richard's condition was. He required dialysis for several weeks.
He had so many setbacks. His life to me felt like it was hanging on a thread. Emotionally it was tough, but every time something happened, I was really reassured by the medical staff. Holy Family did a lot. I mean, a miraculous job.
I felt that everyone really went an extra mile there.
He could go into acute care rehab and really make progress and not maybe languish somewhere on a ventilator or something like that.
Thank you.
I wrote a check to the hospital and I wrote a thank you note because my mother always... He is where he is today mainly because of what the physicians and other staff at Holy Family were able to do for him. I was happy to do it. My heart was just like overflowing with gratitude.
We are in an age where healthcare dollars are short. We want to provide the most up-to-date treatments in a personal atmosphere, and philanthropy plays a great role with that.
The need for quality care is paramount. The demands of healthcare are extraordinary, and without the generous funding that we get from our donors, we could never do this.
We have a new beginning. We have a clean slate. We can start all over again. And not everybody gets that opportunity. And so, yeah, I think we're very fortunate as a couple. We are. Yeah.
Even though I ran into some problems, I've overcome them, and as a result, I could see the kids playing and doing everything growing up. I feel that I'm very fortunate and I really couldn't ask for anything more.